Hi, this is Dr. Tranchitella for Sunrise Functional Medicine, and I did a video recently talking about my own experience in having an autoimmune disorder. I developed Reiter syndrome, or what is now known as reactive arthritis, after traveling in India and getting an intestinal infection. And the way I look at the development of an autoimmune condition and the way that most naturopaths or functional medicine practitioners look at this is that there's three components that generally come together in the development of an autoimmune disorder. One is a genetic predisposition. Having a genetic predisposition doesn't mean that it is predictive of developing an autoimmune disorder, but it can predispose one to developing an autoimmune disorder under the right circumstances. There are also people who develop autoimmune conditions who do not have genetic markers for any of the diseases. The other factor is a trigger. There's usually some kind of trigger that comes into play, whether it's an infection, being either parasites, bacteria, viruses, or fungi. It could be food allergies or food sensitivities, like having a gluten sensitivity that has kind of a delayed sensitivity reaction that doesn't really get triggered until later in life. And then there is your own personal health status. So when I developed Reiter syndrome, there was all three of those factors came into play. I had the genetic predisposition to develop Reiter syndrome. I had an infection. And in terms of personal health, I had just finished naturopathic medical school. And I did a 4-year program in 3 years. When I went to Southwest College of Naturopathic Medicine, they actually offered a 3-year track. I don't think they offer that anymore because it was pretty intense. We were in class or clinic 40 hours a week, and that did not include studying and getting ready for exams and all of that. So I went through this program in 3 years and then did my board exams, and then we traveled to India. And if you've ever traveled to India, well, at least 20 years ago, it's a difficult place to travel. It's very easy to get sick. And it's just a different standard of living than we're used to. It's a great country, there's wonderful people, and there's a lot of great experiences you can have there, but it is easy to pick up on infections there. So all three of those factors came into play for me. I had the genetics, I had the trigger, and I was under a lot of stress. I was coming out of being under a lot of stress. And so the stress component that comes into play is really important to consider because we all experience stress, but when we have a lot of stress or an extremely stressful event, it can suppress and dysregulate our immune system so that rather than fighting infections, we go into a state of inflammation. So in my case, when I had an infection, although it seemed to resolve, it triggered this hyperreactive inflammatory reaction in my body. And had I been in a different state of health, had not been under as much stress as I was, maybe having encountered that particular infectious agent would not have triggered an autoimmune reaction. So when I evaluate autoimmunity in any of my patients, I try to look at those three major factors that come into play. And we may not know about the genetics and all of the markers that they have because we can't really change that. We may know it's there and it's always going to be there, but the things that we do have control over are our exposure to certain things in our environment, whether they're infections or food allergies or toxins or fungus and mold in our environment, and what we do with our own personal health and how we take care of ourselves. We have control over those things, or we can do something about that. So if you're experiencing an autoimmune condition and you're having a hard time getting a handle on it, you have to approach it from a whole body perspective and know that there's ways to turn down the inflammation by addressing your underlying health. This is Dr. Tranchitella for Sunrise Functional Medicine. Thank you for listening.